Okay, so another bone disease, which is more rare, is Paget's disease. And this is when there's an excessive haphazard bone deposit. So we get a lot of bone deposit and reabsorption, but it ends up being a weak bone, but often a big bone. So the bone grows fast, but it develops poorly. We see this, there's a high ratio of spongy to compact bone, and there's reduced mineralization. It usually occurs in the spine, the pelvis, the femur, and the skull, and rarely before the age of 40. So at age 40, someone's putting on their hat and they're like, oh, my hat's too tight. And it's because they've got this really rare disease. Can be treated with the calcitonin and let's just say biophosphates. Could be viral. We don't really know where it comes from. Again, it's rare, but it happens, and it's interesting for skeletal pathology, which is why we look at it. And here we see a normal bone, and here we see that it's like moth-eaten away. So again, that ratio of spongy bone and the area of spongy bone is excessive, and again, it's a high growth rate, so we also get a bulging out. So it's like the space becomes larger, although not stronger. What about age-related changes in bone? I have my Rafinki here with Simba because aging is part of the circle of life. So again, we want to create healthy habits to combat it. Don't think I say it too much this lecture, but or this section. But let's look at children and adolescents. So bone formation exceeds resorption. All right. So in children, their bones are growing and they're getting bigger. Males tend to have a greater mass than females, and that's the genetic predisposition with a sex-linked trait. So in young adults, we have the balance of absorption and reabsorption, right? So, okay, we're getting remodeling, but we're not growing the bones per se, unless we do some very specific exercises to try to make the deposit increase at a different rate. But for the most part, it's balanced. In adults, the resorption exceeds the formation. So we get a little bit older, and now here, doing the same exercises is going to maintain our bone density as opposed to build it. So it's all about maintaining bone density in the lifespan. There's a gene for vitamin D, which determines the mass early in life and the osteoporosis risk at an old age. So there is something here, again, that's genetically linked, and it has to do with vitamin D. As we know, vitamin D is important for calcium resorption into the body, and calcium is important for bones. So this all becomes connected. It begins to decrease in the fourth decade, the bone mass, the mineralization, and its healing ability. So we get a fracture when we're older. We go through a hip replacement when we're older. It gets harder. The bones of the skull are the one exception of that, where we don't see a lot of demineralization or loss of bone mass. And bone loss is greater in whites and in females. Okay, so again, there's some genetics linked to the amount of melatonin. And if we talked about testosterone being a protective for the bones, and as well as estrogen, we still see that in females we get greater bone loss with age, right? Postmenopausal, et cetera there. If I haven't mentioned it before, I'll just mention it again here. Remember the pregnancy? The skeleton that develops in the fetus comes from the skeleton of the mom, right? So statistically, we have more women becoming moms and donating their skeletons than men at this point in our Earth life system, right? Men don't bear children in that way or grow children in that way. So so that's another factor that leads to the bone loss being greater. You saw the healthy spine. I talked about this previously, so this is a bit of a repeat, but look at that illustration of this disc. There's the fancy name, is the annulus fibrosus, and here this is the nucleal pulposus. So we have that's like the center of it. So usually it's just a little bit of that fibrotic tissue that comes out and pinches in on a nerve, right? And the nerves are running out of these spines in between the spines in these little holes. So I'm looking at healthy vertebral discs. This is a much better image. So let's just stick to this one. You can see the nucleus pulsating here so beautifully. Love this image. Yeah, so this is a nice, healthy intervertebral disc. Bone loss, right? We looked at this before. I'll skip it. Anything additional? Let's recall that the pelvis is different shaped for men versus women, and this has to do with over time the pelvis developed to bear children, so it has a wider range of opening here in the pelvic brim. This is narrower in a male. So in general, we get a longer, more narrow-looking pelvis in a standard, typical male version of the human anatomy. Okay, these are very generic and standard. When you look at men and women, and you compare their body mass, their soft tissue with their hard tissues, like the skeleton, you can find great similarities between men and women. So again, this is the generalization slide here, and we can see it in the bone anatomy as well. Look at the space between the coccyx, the sacrum, and the rest of the pelvic bowl, right? So here you can see how that is allowing for more space, and that's where the head of the baby exits, right? And there's a flexibility in there with the relaxin of the pregnant woman, and that's able to even open up a little bit more. I'm gonna have to say it. So if you're trying to push a baby out and your sacrum is flat on a bed, it's not going to have a lot of place to go. You're not going to get the extra amount of opening, and pressure is going to be put on the bone of the coccyx, right? And that can lead to a fracture. A lot of things can lead to fracture in childbirth, but there's this new age movement towards kind of laboring and giving birth in different positions, and you might have seen different things clinically. It was really hard for me to see a woman go through childbirth and the nurse was trying to keep her pelvis placed down onto the bed. And she's lifting up off of the bed because it's painful to have it down there when there's an opening trying to happen, and she could feel that. So it comes from a really archaic tradition of placing the woman in the best position for the doctor to like sit in the chair and get the baby and maneuver it out. You can have your own professional opinion about this. This is mine. And plenty of women can birth a child with in the reclined recumbent position with no problem. I just find that if someone's really physically uncomfortable in that position, that they shouldn't be forced to do it. You can do it in side lying or in a more of like a squat position or even on hands and knees. So yeah, that's a little bit of it's a tough one to go through. So if you're a nurse in the labor ward, like you could consider trying to get everybody on the same page for allowing the woman to find some bit of comfort during the chaos. What about sinus cavities? Okay, so we're just looking at additional bone features, and here in this radiograph, we're seeing that where there isn't bone. Okay, so we're looking at where there isn't bone in the skull, and that allows for a resonant passage in the whole system. So we have fluid that gets drained out through the sinus cavity. So having that space allows to an equilibrium for the pressure within the skull, right? Remember, like there's no expansion within the head, so you have just enough room for your brain, just enough room for your eyeballs, and any excess of fluid needs to be drained down and out. Here is a picture of a normal baby with a normal curvature of the spine. This is here to just illustrate that what's normal in childbirth, right, from the fetal development isn't the healthiest for the lifespan. So the body's going to change throughout the lifespan. Here we see an increased lordosis. Again, natural for normal development. This is a little bit of a hyper one, but you might see that with children and different genetic makeups as well. So this is not lordosis or based on excessive weight. This is a natural toddler or young child development. And I think that if you were working with this population and you were measuring this and you see something in a hyper extensive way, it could be something to keep an eye on and adjust the environment um, to change the ergonomics of how the toddler is moving in hopes to make an intervention to develop the spine in a certain way. You can use back braces for more invasive change, and those are things that people consider doing for spinal health. But again, this is normal, and then the most part, recommendation is lack of intervention when possible, but always early intervention when necessary. Here's an abnormal spine. This is scoliosis, which you have heard about. It leads to there's a bending in the vertebrae, right? And if the vertebrae is bent, then there's going to be an impact on the rib cage. So when someone bends over, which is what's illustrated in this picture, is that you see the rib cage bulging up. That's a sign of a curved spine. So it's very obvious the more severe it is. You can see the curvature of the spine, but the bulging up of the ribs would be a slight indication with children. So when they screen for this in the school, because they will do an intervention for back bracing, that being because when the rib cage is compromised for its normal growth and development due to curvature of the spine, it will impact the breathing, right? It impacts the lungs and the lungs' ability to develop properly, as well as inhale, exhale properly. This is scoliosis by x-ray, so we're just seeing it here. And again, it's a bend in the vertebrae, and it leads to a torquing of the rib cage. Here's the normal versus compressed lung. So here's a normal lung and its tissue matter, and then here it looks smaller because it is compressed. So this would be the same person, different sides. Right, so we don't want compressed lung tissue. We want it to have the space that it needs. Okay, so we could, maybe you'll do this in a school setting if you're a nurse in a school or a physical therapist. So yeah, uneven shoulders are a cue, the curve in the spine, and then the uneven hips. So we look at that, and there's so many different reasons for uneven hips. But in general, when you get all three of these together, right, that's going to be indicating scoliosis. Look at how the shoulder blade is uneven down here as well. So you can use any bony landmark to assess symmetry and give a diagnosis and a prognosis and decide on an intervention. Here's the brace we mentioned. Ta-da! Okay, and it's seen to be quite effective, a method to prevent it and any dysfunctions that could arise from this pathology. I'll just mention here, so this is kyphosis a bit normally, and the thoracic spine. Here, I'm just seeing my label, kyphosis of the thoracic spine. Again, it's not great, but it's quite normal with forward head posture. It's a phenomena of the times and also of the activities that people choose to do. Imagine if you work at a computer 40 hours a week and you're a cyclist for 10 hours a week, and you don't practice good posture or extension. You're going to have forward head position and kyphosis. You're going to put a lot of pressure here between C4 and C5. That can lead to neck issues, compression in intervertebral discs. I have a cyclist friend who's an engineer, and he just went in for neck surgery. I need to check in on him and see how he's doing. I'm sure he's fine. But yeah, always lengthen, folks. Always extend, lengthen, sit up, sit well when you're sitting as long as you can, tolerate the pain, relax out of it, come back into it, build the erector spinae, right? Build the levator scapula, the rhomboids, get everything strong in the back body, and go for that healthy spine for the lifespan. Tuberculosis is a disease that we don't really see here. It's in different countries. It is born into a bacterium in milk products and things like that, but it does affect the bone when it is untreated or not caught early. So this is a very severe case where the bone deposition is excessive, it is abnormal, and it affects the lungs as well. So you get plaquing in the bones in the lungs, and that is again not common in our culture here or our environment, and becoming less common worldwide as World Health Organization moves towards education about tuberculosis and prevention and then treatment. The thing I want to say about tuberculosis on the ground, having lived in Niger, is people don't take it seriously. They're like, oh, just going to drink the milk. It's fine if you get tuberculosis because it doesn't affect everyone. But that's kind of the mentality that I encountered overseas. It gets in the way clinically because it's a airborne pathogen, so it can be ingested right through the milk. But then once it's in your system, it can be contagious to others. So when we work clinically, we have to get these TB screenings. Usually, it's just an injection. They test for it. They stick you. You go back. It gets measured. If there's no reaction, you're fine. If you go back, it gets measured. It's too big. Now you got to get your lung scanned to see if you have tuberculosis in them. And my understanding is that that would prevent you from working clinically. So and maybe you could take precautions, but I'd have to find out more about that. I know personally that from the screening, just going through it for my clinical experience. We mentioned lordosis. It's a fancy word for exaggerated lumbar curve. Again, some of this can be normal, but the beauty of the spine of the curve is it's designed when all things are equal to be a shock absorber. So it is in that S position. You do want some of that to be like just like a spring, and the design of the S of this curve absorbs that shock. Here we see excessive one in a healthy weight person. So whether or not this becomes an issue, or that would just be if the person presents with symptoms, maybe, maybe not. There's plenty of genetic makeup that would account for this, where there's no issue at all. Okay.